Hello, my name is Kiosha Harrison, and I am in public speaking. My topic to talk about for my persuasive speech is how elderly citizens should have free medication or lower costs for medication. Have you ever been in a drugstore and you're behind an elderly person and they're asking, well, how much does my medication cost? Once you notice how much the medication costs, a lot of the times you overhear the cashier tell them it's about $200 or $300, and you hear the customer say, "Well, let me see which one I can afford." I have been behind multiple older people, and that's the discussion that I'm overhearing. Me myself, I sometimes even have to question what medication I'm going to take home depending on how sick I am. And I'm a younger adult, and I can actually work more hours in order to afford the things I want. There's about 72% of low income elderly people who cannot afford medication. This statistic has been brought up by United Healthcare. I don't think that's fair. A lot of these older people have already put in their time at their jobs. They have been teachers, doctors, cashiers, janitors. They have served their communities, and a lot of these low income people have been military. I don't think that's fair that we as Americans in the United States have thrown away millions and billions, probably trillions of dollars over simple things that I consider simple, but we can't afford to help the elderly or sometimes the veterans afford medication that should be free to them. I know for a fact that I did the statistics of it. So there is about $1 billion left on the table after taxes is done of unclaimed tax money. Why can't we just use that $1 billion to help afford more medication or even free medication for the elderly people? As a younger adult, I have grandparents. I have a mom that's all on fixed income, and a lot of times I have to sit down with them and budget their money and see what they can afford and what they can't afford. I don't think none of these things are fair. And there's about, for an older adult of 65 years or older, more than 30% of these older adults are in debt up to at least $30,000. That's a lot of debt to say you're over 65 and you have already retired to still be in, but you also have to worry about cost of medication. And then you have to think about the downside of this. What if you're an older person and you know it's going to cost you a couple $100s to go to the doctor and get medication, but you decide, I'll just stay at home and get sick? You'll just tell your children or your grandkids, well, I'll feel better, I'll take some home remedy, and come to find out you're making your condition worse. We as Americans, that should not be a choice for them. It should be, go to the doctor, get your medication, get better, not decide to stay home, get sicker because you don't want to not pay your bills. It should never be a choice between medication and bills, especially not for the elderly. And also, when it comes to us one day we will be older adults. Will we have the income later on in life to afford medication if something come up? Will we be debt free, which I doubt, by the time we get elderly? Will it be a situation where our children is now having to help us balance, or are we going to pay a bill, or are we going to get our high blood pressure medication, diabetes medication, heart failure medication, things that you have to have on a daily basis? It should never be a decision on whether or not that we're going to help the elderly or veterans get medication. It should strictly be on, let's move money that we throw away on helping them.